Hi, my name is Dr. Alif Musaji, the Smiling Dentist, and this is the third part of our series on dental disease. Today we're going to talk about tooth wear. Tooth wear is a threat to the longevity of a patient's dentition, so all the teeth that are in their mouth. There are two other diseases that we've spoken about in this series. One of them is dental decay and the other one is gum disease. Both of those diseases are bacterial mediated diseases. So the bacteria in our mouth has an effect either on the tooth in dental decay or on the surrounding structure, the supporting structure in gum disease. But tooth wear is slightly different. It's not really mediated by bacteria. It's more to do with challenges that we put into the mouth. And it can happen in one of three ways. So the terms that we use are erosion, attrition, and abrasion. And I'm going to talk a little bit about each one. Erosion is a chemical process. It's one whereby there is acid in food. So we spoke a little bit about dental decay and we explained that the loss of mineral from the tooth is because we eat sugar. Sugar is converted to acid by bacteria and the acid will basically take mineral out and burn holes in the tooth. But what if we bathe the whole mouth with drink like fizzy pop, which has phosphoric acid in it, or other fruit juices that have been processed and pasteurized, which have really high acid content? Then we will have an effect of softening the teeth and even removing mineral all over. And so the pattern of loss of tooth is different to that of dental decay. So this is erosion, and it's something that we have to be really careful about so that we're not allowing very acidic foods and drinks into our mouth. Now, sometimes patients do ask me what types of foods are safe and which are not, and they often ask about fruit. And what I've tried to explain to patients is that fruit that's natural, that hasn't been processed, is beautiful. It will not cause them problems. The issue happens when it's been processed in some way, whether into a smoothie or a fruit juice or something like this. And again, it's not the cutting up of the fruit that is the problem, but it's this process of pasteurization, which I know is an important and a safe process to make the food safe to eat, but raising the temperature of it and then dropping it back down again makes the food or drink much more acidic than it was before. So this is where we have to be careful. And that's erosion. Another one that we mentioned is attrition. So attrition is where that happens because there are excessive forces between teeth. Now we have another video that I've done which is called occlusion, and that talks in much more detail about why we may develop a habit of grinding our teeth together. But suffice to say, if we do grind and rub our upper and lower teeth together, then of course it's going to wear them down and we will lose our teeth. And taken to its logical conclusion, then a tooth that's probably this high and that wide will eventually become less of a rectangle and more of a square. And our teeth will start to look funny as we get older. And then the last way that we can lose teeth is through abrasion. So this is where our diet is one where we have very hard food that physically rubs the teeth. Or we may have a habit like biting our nails or smoking a pipe. I've once seen where a patient had this wear that was almost like a semicircular notch in the top and the lower teeth. And that happened to be where they put their pipe all the time and they kind of ground their teeth on the pipe. So we sometimes see these interesting patterns of wear, and as dentists we have to almost see it like a crime scene and try and work out exactly what's going on and how it was caused so that we can break that habit, break that cycle, and then stop it from getting worse before we can even start thinking about trying to put it right. So with abrasion, one tip I would give you is that it's a very popular and healthy breakfast is to have fruit juice and then to have muesli. But please don't have it in that way, in that order, because the fruit juice, remember, will erode the teeth, soften the enamel, and then you'll eat your muesli and the hard muesli will actually wear that softened tooth down very, very quickly. And I'll also give you another tip on this as well. And this one is a question I'm often given about what's the best order to do things in the morning. Should we brush our teeth and then have breakfast? Or should we have breakfast and then brush our teeth? Now, I would strongly recommend that you always brush your teeth first and then have breakfast. And actually there's two reasons. One is very applicable here. What we don't want to do is have had any kind of acidic food that would soften the enamel and then we start brushing it, because of course that can also increase the wear experience from the point of view of abrasion. But the other thing that's important is that in order for dental decay to happen, you need to have the bacteria and you need to have sugar and you need to have the tooth structure obviously there as well. So the tooth structure is there or thereabouts. But if we've brushed the teeth really well and remove all of the bacteria, remove that plaque that's going to cause the decay, and then we eat, we are much safer because we're far less likely to get decay. So that's a really nice take-home message from the video. Brush first and then have your breakfast after. I hope you've enjoyed our video on tooth wear today. And remember, this is the third part in a series of 3, which is all about trying to help to inform you about dental diseases so that you can protect yourself from them. If you like the video, then please join us for more on the Smiling Dentist YouTube channel. And don't forget to like, subscribe and share.